Hi, Shan Orthopedics here. So I'm going to talk on carpal tunnel syndrome. Hopefully it helps you to understand the pathology better and probably help you or someone that you know suffering from this to get early treatment. Now, carpal tunnel syndrome is more common than you think. It is one of the common causes that brings patient to the clinic with complaint of numbness of either one or both the hands, and it can affect up to 10% of the population. Now, carpal tunnel basically refers to the space around your wrist here. So this space is a very small space. It is made of some bones and a very hard tissue on the front, and within this space an important nerve passes through. The nerve is not the only important structure here. We also have tendons that passes through, but the nerve is the most sensitive, most delicate structure that passes through this tunnel. So when there is an increase in the content of the tunnel, or basically anything that increases the pressure of the tunnel, the median nerve will be compromised first. So the median nerve is responsible for the sensation of all your fingers except the little one, and also is responsible for the movement of your thumb. Now, in most cases, what you experience is numbness of all your fingers, certain clumsiness with the thumb-related movement, but what truly bothers the patient is that it disturbs their sleep at night, and this is more often the primary reason why the patients seek for treatment from the doctors. So basically what they will say is that they have numbness that disturbs their sleep, pain around the wrist that bothers them, wakens them up from the sleep. So what happens is that basically when you're sleeping, you might accidentally be flexing your wrist. So you might be putting it in this position without even knowing it, and by doing so you're basically reducing the space of your carpal tunnel, thereby you're increasing the pressure inside, and this aggravates the symptoms. In certain cases such as patients with diabetes, thyroid disorders, if you have inflammatory conditions, smoking, all this can also lead to carpal tunnel syndrome in a very gradual phase. In cases such as fracture of around the wrist, you might develop acute carpal tunnel syndrome. You've got a fractured radius or a fractured wrist bones. What happens is that bleeding goes into the space and fills up the space rapidly, thereby causing acute carpal tunnel syndrome. So when you come to us, we'll get a detailed history, we'll ask you to show where the numbness is, we will even flex your wrist to aggravate the symptoms. So clinical diagnosis is sufficient in most cases. In very few cases, we might need to do some extended investigation. So in the early stages when the symptoms are not frequent, something that's intermittent, medication, splinting is sufficient, steroid can be beneficial, but once this treatment fails or there is evidence of muscle wasting, then surgery is indicated. So I hope that this video is beneficial to you. Get yourself checked early, get yourself treated early, because the earlier you treat it, the better the outcome is.